All right, guys, it is the day. I'm getting my Pfizer shot number 3, my booster shot, and I'm so excited. I actually have a full day of clinic today, but hopefully I'll get it on my lunch or something like that. I hope this one is not as reactogenic as dose number 2, but I'll do the same thing as last time. I'll take you through all my symptoms and all the things that I do for them and see how long they last and all that stuff. So yeah, very excited. So as I'm recording this video today, people who've had their primary series dose 1 and dose 2 of the Pfizer vaccine and after 6 months can receive the booster shot. The recommended population is anyone over the age of 65 or people from the age of 18 to 65 that have comorbidities that put them at increased risk of having severe COVID, or anybody of occupational risk, such as healthcare workers, doctors, nurses, EMTs, frontline workers such as grocery stores or teachers, caretakers. So a few days after filming this video, the FDA has also approved the Moderna vaccine boosters for the same patient population 6 months after your primary dose series. But instead of the 100 micrograms in the first and second dose, it will be a 50 microgram booster dose. As for Johnson & Johnson, the recommendation is that you can get a booster after 2 months of receiving your first J&J vaccine of any of the 3. So you can get Pfizer, Moderna, or Johnson & Johnson. The research studies have not fully been out on that as of yet, and there's no true recommendations of which one you should get. But the studies have shown that mixing and matching is totally safe. And so I would have personally wanted to try the Moderna vaccine or the Johnson & Johnson, but any of them would be great. Any of them that are available to you. Put it in your arm. Okay. We are on our lunch. Well, actually I have 3 more minutes left for my lunch, but my arm feels fine. I'm trying to use it as much as I can so that it doesn't get sore. I plan to do some push-ups, but I ate like crap yesterday. We were watching the game and I had 3 slices of pizza, a huge family-sized bag of Doritos, the ranch ones, and I ate half of it. And then I also had some chicken wings and a cookie and some empanadas. Yeah, I splurged last night, and I don't know, maybe I was just stressed, but now I feel really bloated and don't feel as good. So now I'm having a smoothie. Yeah, I'm not really hungry just because I ate all that stuff last night. So as I tell my patients, calories don't just start over, they carry on through the next day. And so yeah, I'm just having a small lunch and then I'll probably have dinner, and that's normal. But yeah, I'll probably do some push-ups right now. I'm free at last! Woo! Oh my gosh, guys, it has been a long day, and you're seeing up my nose because I don't want you guys to know exactly where I work because, gotta be safe and all. Oh, is this way better? All right, so it is currently 6 p.m. So it's been 6, 7, 8, been 8 hours? No, yes. It's been about 8 hours since my COVID vaccine, and I feel a little bit cold, but I don't know if that's cold because it's cold outside, it's 59 degrees outside, and I'm chilly, but I'm also tired because I worked all day. I saw 17 patients, and some of them are very difficult, but then I was also very happy for some of them. So I don't know if it's just the general Friday, I'm tired, I need a break for the weekend, or is it because I got the vaccine and I'm tired. It's not too bad. Just ready to go home and have dinner. And so yeah, so far so good. Might do some more push-ups at home. All right. Hi everyone. So it has been 24 hours, actually a little bit more than that, because I wanted to wait on new information that was coming out on the boosters to let you know all about Pfizer, Moderna, and TripJ. So over 24 hours after getting Pfizer, I had those possible chills and feeling tired. But as I said, it was after a long day of clinic, and then the next morning I walked Summer, I did my workout, I felt amazing, and so I would say no reactions at all from the Pfizer vaccine. So there's really nuance to this of whether you should get the booster or not. There's studies have shown that you still have very good efficacy in the vaccine with just the primary doses, like dose 1, dose 2 of Pfizer and Moderna. So the booster would be for asymptomatic disease or infection. What that means is right now we find that there are breakthrough cases, but the breakthrough cases are like cold-like symptoms. You feel like you have body aches, you have the sniffles, and you really can't work because you're still tired and you're still sick, but not sick enough to need hospitalization, intubation, and things like that. And so with the booster, we're hoping for asymptomatic infection, which means that I wouldn't be affected at all, or that even if I had been exposed to a little bit of virus, my body clears it so rapidly that I wouldn't get sick. For the people who you're trying to convince to get the vaccine and they've already been infected with COVID in the past, like, what's the point in getting the vaccine, right? You already have antibodies. And the research that has shown is that those who get a booster shot or additional shot of, like, say, mRNA vaccine after initial infection has greater neutralizing antibodies than those who just had the infection alone. So that means that you'll have more protection. For those people who say, like, natural, I don't even call it natural because there is infection mediated antibody response or immune response versus vaccine activated immune response. Your immune system is always natural. There's nothing unnatural about it. So the argument here is that infection-mediated immune response, you would have a better protection versus vaccine-mediated immune response. But my argument is that you don't want to get sick from a deadly virus to prevent yourself from getting severely sick from a deadly virus. Does that make sense? So I've been getting questions from patients asking to check their antibody levels, and I would recommend against this because it gives you a false sense of security. The antibody levels don't really tell you anything. What we're looking at and what the labs can't check is neutralizing antibodies, if the antibodies work or not in fighting off this virus when you become sick. And what we found is that vaccine-mediated immunity, when you have antibodies created from vaccines, there is a lot more neutralizing antibodies as compared to someone who has an infection without vaccination. And so a lot of you have asked me, like, how do you convince your family members or your friends to get the vaccine? And as of right now, there's so much information out there already. Logically speaking, there has been millions of doses of vaccines given out already. If we had seen deaths with vaccinations, we would see them already, but we haven't. I got my first dose of Pfizer back in December of 2020, so it's almost been a year. I would say I'm happier and healthier than I have ever been. Is that because of the vaccine, or is that because my lifestyle changes? You know, but I'm still here. I'm not dead. A lot of my patients who had the vaccine, the majority of them after the second dose, they had a little bit of headache, they had some body aches, some joint aches, but all of those things went away at most at 3 days. And I can treat those things with ibuprofen and Tylenol. I can't really treat death. Like that's really hard to treat for me. And I've seen a lot of patients have long COVID, especially young, in their 20s, like from 20 to 29, even like early 30s, younger than me, who have had long COVID. And what does long COVID mean? They have headaches that are debilitating. They can't get out of bed for days at a time. They can't eat because they feel like everything makes them nauseated, or it just tastes rotten and food doesn't taste good anymore to them. If that ever happened to me, like, I would rather just die, to be honest, because like I live for food. And then they have pneumonia or lung damage and scar tissue within their lungs, and so they can't do the things that they used to, like getting up and getting out of bed, or going to the bathroom without significant shortness of breath, or going upstairs to their bedroom. And if they were really active, they can't lift as much as they used to. They can't run as far as they used to. They can't even walk as far as they used to. And so it's hard to say who that population will be. So right now they say it's around 5 to 10% of people who will have long COVID. So it's hard to say where you would fall, or where people would fall within that spectrum. It could be like you have no symptoms at all, or you're dead, or you have long haul COVID, right? So you have symptoms for lasting months at a time that affect your daily living and possibly for the rest of your life. It is hard to say. They have found that with people who've had long COVID, getting the vaccine can decrease some of the symptoms, such as shortness of breath, because it takes away and it eliminates kind of like the virus reservoir that you're holding on to, kind of like shingles or kind of like HSV, herpes, and things like that. You get the virus once and it stays with you for the rest of your life, and so clearing out those reservoirs will help you with that inflammatory response. Some of my patients who have shortness of breath, I tell them to use the spirometer. They have it on Amazon for fairly cheap, I think like anywhere from $6 to $20, and then it helps open up all those small alveoli and open up those lungs so that you recruit all those cells basically and use your lungs again to help with recovery. As a doctor, I always try to focus on prevention. So getting the vaccine, preventing yourself from getting the virus in the first place. But if anything does happen, these are some of your resources and these are some of the things that you can do. All right. Let me know if you guys have any other questions. What are some of the things that are people's excuses of why not to get the vaccine? And we can discuss that in the comment section below. And yeah. That's it for this video. Thank you so much for watching. I'm hanging in there. I hope you are too. Until next time, subscribe because we do put out new videos at least once a week, and I'll see you then. Peace. So I've been getting, sorry, I use natural lighting so the sun is coming in and out, so excuse me for that. So I've been having compared to someone who has, whoa, so bright. Why? We'll just wait for, this cloud to pass real quick. Oh no. Is it going? Hurry. Okay, it's going. No. Okay, it's coming back. All right.